Good morning. This is Anna Davis with the Oregon Health Authority. We're going to give people a couple more minutes to join, and then we will get started with our discussion of meal and rest break requirements. Again, this is Anna Davis. Hopefully you should be able to hear us now. We're giving folks a few minutes to join, and it looks like we've got a critical mass, so we're going to go ahead and get started. So I am Anna Davis. I'm the Survey and Certification Program Manager with Health Facility Licensing and Certification, and I supervise the acute and continuing care surveyors across Oregon, which includes the hospital nurse staffing team. And prior to that, I was the nurse staffing policy analyst on this team. And I will pass it to Kimberly.
Hi, my name is Kimberly Volker. I am the nurse staffing policy analyst with the Oregon Health Authority. I provide policy and analytical support to our nurse staffing team. I help write our nurse staffing reports and coordinate our nurse staffing advisory board. We're very excited to have you here with us this morning.
So we are going to talk about meal and rest break requirements today. We previously had sessions on an overview of the Oregon nurse staffing law and then a session on nurse staffing plans. Both of those are available on our website, and you can listen to them anytime. It's www.healthoregon.org/nurse staffing. And with that, we're going to go over what we will be covering today. For each session, we have an agenda so that we can make sure we're on track. So we're gonna do just a reminder, an overview of the nurse staffing plan, just a quick slide or two about that. Then we're gonna go in depth on the meal and rest break requirements as required by the law. And then we have some information about nurse staffing plan attachments, because that often can come up in terms of meal and rest breaks. And then we have our section on myths that we expose and write about what's the truth there. And then we'll start answering your questions. We have received questions in advance, and we do take questions live and answer those as well. So with that, I'm going to hand it to Kimberly to talk about the nurse staffing plan and just remind us of where we were on that.
And so we're going to do this brief nurse staffing plan overview. And part of the reason why we're doing that right now is, as well as that meal and rest break requirements are a part of that nurse staffing plan. So one of these is that any hospital unit where nursing services are provided must have a nurse staffing plan approved by the nurse staffing committee. That nurse staffing plan must be reviewed by the hospital nurse staffing committee at least once a year, but the nurse staffing committee can update the plan more frequently depending on the unit's needs. We have that described in Oregon Revised Statute 441 and 155 and 441 156. And Oregon Administrative Rule 333, 510, 110. We can go on to the next slide. So one of those requirements, as I was mentioning, is that the nurse staffing plan must consider tasks not related to direct patient care, including meal and rest breaks. So there's three important components of that. That nurse staffing plan must ensure that nursing staff members receive meal and rest breaks. Whenever you see NSM on the screen, it means nursing staff members, which are RNs, LPNs, and CNAs. So it needs to make sure that the nursing staff members receive their meal and rest breaks. You must have a process to document all breaks. That means whether that break was missed or whether that break was received. That's the rest break and meal break. So all of those, it needs to be very clear. And it also has to have a process to make sure the unit doesn't drop below minimum numbers during breaks. That nursing staff member who is on a break is not counting towards those minimum numbers. And so that's required by Oregon Revised Statute 441, 155, Section 2H, and Oregon Administrative Rule 333, 510, 110, Section 2H. A reminder here about nurse staffing plan attachments. Any document that is part of the nurse staffing plan must have been approved by the hospital nurse staffing committee as part of the nurse staffing plan and be referenced in the nurse staffing plan by title and date or version number, or be included as an attachment appendix. So if you have a policy about how meal and rest breaks are going to be delivered and how people are going to make sure that they're getting their meal and rest breaks, that policy needs to either be very clearly attached as part of that nurse staffing plan and very clearly approved as part of the nurse staffing plan, or you can, within the plan itself, write the title and version date and name of, or version/date of that policy. That way it's very clear that that policy is what is being referenced in the nurse staffing plan and getting approved as part of the nurse staffing plan.
And I will note that there have been a few hospitals, I don't see this very often, but there have been a few hospitals that have had meal and rest break as a whole hospital-wide plan, and then the unit-based plan set the minimum numbers. That is an option. It doesn't necessarily work in all hospitals, but that is an option that some hospitals have explored.
So we're going to jump to these nurse staffing myths. And so our first myth is that you only need to document meal breaks, not rest breaks. The truth is that all meal breaks and rest breaks must be documented. The hospital must document whether the break was received or missed. We also hear a lot of myths about buddy breaking. We've heard a myth that buddy breaking is compliant with the nurse staffing law, and we've also heard that a myth that buddy breaking is not compliant with the nurse staffing law. The fact is somewhere actually in the middle. So buddy breaking is not inherently compliant or non-compliant. Instead, the nurse staffing plan must describe how it ensures that nursing staff members receive all meal and rest breaks as required, and how it ensures the unit does not drop below minimum numbers. If the unit is using a buddy breaking system, the nurse staffing plan must clearly describe how the unit does not drop below minimum numbers during buddy breaks.
So here's my example of this. If your nurse staffing plan says you need 3 RNs and 2 CNAs, and it's a unit that uses buddy breaking, if the nurse staffing plan says 3 RNs and 2 CNAs, then even when someone is on break, there need to be 3 RNs and 2 CNAs on duty on that unit. And you can't count the person who's on break as being on duty. So the question is always going to be, well, if you're buddy breaking, how are you ensuring that you still meet that minimum? Now, if your minimum is 3 RNs and 2 CNAs, and you happen to be staffing that day with 4 RNs and 2 CNAs, but your set minimum in your nurse staffing plan is 3 and 2, then if you have 4 and 2 on duty, if you use buddy breaking and you don't fall beneath that 3 and 2 at any given time, then that would be an acceptable use of buddy breaking, because you would be keeping to your minimum as you've specified in the nurse staffing plan.
And so that issue then, as well as ensuring that you have a clear process to make sure that you're not going below that minimum number during meal and rest breaks, simply saying we do buddy breaking isn't necessarily having that level of detail like Anna described of, oh, we're going to staff one above, or you need to have a process in there to clearly describe how you're not going to drop below minimum numbers during those meal and rest breaks. Another myth is that nurses count towards the unit's minimum numbers while they are on break. The fact is that nurses are not considered on the unit when they are on a break. Even if they're taking their break on the unit, they are not considered on the unit. They do not count towards the minimum numbers of nursing staff members on the unit when they are on that break. Another myth that we've heard is that nurses can complete charting and other tasks during breaks. The fact is, a nurse is not on break if they are completing work tasks during that time. The hospital may be cited for failing to provide the nurse with a meal or rest break if they're doing work tasks during that break. Additionally, requiring work tasks during a break may also be a violation of Oregon Bureau of Labor and Industry requirements. Those BOLI requirements are outside of our jurisdiction, but it's also still something to be aware of.
While we're talking about BOLI requirements, we do get questions from time to time about combining meal and rest breaks, or when you have to take that meal or rest break, how many hours into the shift. Those are both BOLI issues. Those are outside our jurisdiction. Whether or not that's covered in the nurse staffing plan, that isn't something that we regulate. That is something regulated by BOLI. So with that, we are going to go ahead and jump to some of the questions we've received. And so I'm going to raise the question of whether you can adjust meal and break requirements by putting it in a union contract.
And the answer to that is that that union contract and those nurse staffing plans, those are separate documents. So you would not want to be combining those. And whatever that union contract is doing, it's not going to be changing what that nurse staffing plan is doing. So your nurse staffing plan, that is your roadmap to the unit. It needs to be very clear just from picking up that as a loan document, what needs to be done for the unit and how that unit's getting staffed, how meal and rest breaks are being provided, the type of patients you're seeing on that, true total diagnoses. So that union contract is a different document, and the nurse staffing plan needs to be able to live on its own in describing how meal and rest breaks are happening.
Another question we have is, can an employer pull you aside and ask you why you aren't getting your meals and rest breaks if we are using the buddy system?
So an employer is able to ask you about whether you've received meal and rest breaks. And yeah, Anna, do you have any?
So what I would say is the phrase buddy system always makes me say, well, what do we mean by that? Are you going below your minimums or not? So that would really be my question. But if you are going below your minimums, then that's an issue to raise with the nurse staffing committee at your hospital and say, hey, we're concerned that our staffing plan has us going below our minimums on our meals and breaks. That's not really a compliant plan. What can we do to fix this? It's sort of separate from the question of what questions can your employer ask you, but I always have to ask that question when you're talking about buddy system. Are you using a system with minimums, and are you keeping to your minimums? Because that's what's required by the law.
We have another question here is, if the shift is below the minimum numbers, or if you leave the unit while the shift is below minimum numbers to take a meal or rest break, is that going to have a nurse put their license at risk?
And what I would say is that this is partially a question for the Oregon State Board of Nursing, and we would definitely encourage you to reach out with your specific question and the nuances of that question. If in general you feel like your nurse staffing plan is not adequate to create safe nursing care for your patients when somebody takes a break, then again, that's an issue to raise with the staffing committee and to say, our staffing plan isn't working at meals and breaks. We don't have safe staffing. So I have a question about, if somebody clocks out for meals and breaks, can they be required to remain at the hospital?
And so that is actually more of a BOLI issue to my understanding. So BOLI being Bureau of Labor and Industries. The nurse staffing rules don't mention where the nurse is required to be when they're on a break. And that issue, I believe, like I said, I think that's more of a BOLI area.
It does, I think, get into the BOLI issue of, are you on a break or not? What about, can an ED provider count as the second person in a department for a meal or rest break?
And so this, to an extent, this gets in the question of who are we talking about when we say provider? Are we meaning a physician? When we say ED provider, if you're talking about a physician or a nurse practitioner or someone else who has advanced licensure, the thing to keep in mind is that any individual who's working in that unit, if they're counting as that second nursing staff member, they need to be working under the supervision of the nurse manager and performing activities that are within the scope of the individual that they're practicing. So the physician would be doing nursing duties, for example. This would still require a waiver. We generally don't see, we've heard from hospitals initially expressing interest in this idea, and then when they understand the limits that would be placed on the physician, we haven't had anyone want to follow through with that.
Because the physician would then have to be within the nursing chain of command and could not be doing physician duties. So I think that's where the stumbling block is. Same with physician assistants, nurse practitioners, but what about techs?
We do very commonly see technicians counting as that nursing staff member. So we've also, depending on the unit, we've seen respiratory therapists occasionally for some travel situations. Right.
For transport situations, yes, transport. A unit that their job is to do transport. We also see we see
mental health technicians,
surge techs. Again, we're not talking about ED then, we're talking about some other units. But all of those would require a waiver because those individuals are not nursing staff members. And to request a waiver, that would have to be sent to our nurse staffing mailbox. And that's mailbox.nursestaffing@odhsoha.oregon.gov. And a member of our team can put that in the chat. I will do that. Do you want to ask another of our questions?
Absolutely. I see a question here, can a rest break be taken with a meal break? That one, again, seems to be a bully-centered issue.
Yes, I would agree with you on that.
I see a question here, do surveyors check to see if there are staff physically present on the unit during meal and rest break times? So there's a couple different ways that we measure if you're going below minimum numbers. The most common way is for us to do a record review. We're looking to see if we get an indication that people aren't receiving their meal and rest breaks, or if we get an indication that the unit's dropping below minimum numbers during meal and rest breaks. We would do a record keeping review to see for a period of days and for different shifts, are people getting their meal and rest breaks, and is the unit maintaining those numbers during meal and rest breaks? That's, like I said, that's a record review. For the full nurse staffing survey, all of the units surveyed will also get a unit on-site tour with the surveyor. And the timing of that is really going to differ from one hospital to the next, and it really depends, are people actually on break when that is happening? One of the questions asked is, have people received meal and rest breaks during that interview that they have with direct care members? But again, the timing of that's really going to vary. If they notice while they're on site and physically on the unit that, hey, there's people on breaks and you're not meeting your minimum numbers, they would definitely record that. But the timing of that one can really vary, and it's primarily record reviews when that does get cited in the report.
Although we've also had conversations with them, with the surveyors, to plan for these situations. If you were to go on to a unit at the beginning of shift, then you can focus those questions on the last shift that the person you're speaking to worked, and they can tell you about their experience of, did everyone get their breaks during the last shift, and what was the coverage like? Because we know that you know, when the surveyor comes on to that unit, it may be at the beginning of shift, it may be at the end of shift, so you may have different information available about today's shift. So what does it look like if an employee refuses to take a break when offered and wants to wait, and then tries later and there's nobody available to cover for that break?
Ultimately, your nurse staffing plan needs to have a process to ensure that people are getting their meal and rest breaks. So part of that with the nurse staffing plan should be able to consider and address how individuals are going to be able to get that break and to be able to plan for that to an extent.
I would also say, I know that different units have different ways of determining the break order within a given shift, and who gets to go first and who gets to have their pick of when they take their break. And that can be a significant sort of political negotiation. The question for us is always, does the nurse staffing plan set up a system whereby everyone can take a break? And then if it turns out that you don't get your break at the time you specifically wanted it, our question is still, well, was one available? And then Boley's question was it within their time frame that they require?
Yeah, so all of those issues about timing of break, that's going to be Boley questions. So I do see a question here. If you have two specialty trained RNs always in a department, you expect a third RN to be there just so one can take breaks.
So if your minimum is 2, if you set in your nurse staffing plan that there will be 2 RNs at all times, then that's your minimum, and you can't fall below that even when someone's on break. So there would, in that situation, if the minimum is written as 2, there would need to be a third RN to then cover when either of those individuals take a break.
You can do that different ways. We've seen a little bit more often in the large hospitals. Sometimes they'll bring in a float nurse who's been trained to that unit and has the qualifications and competencies necessary for that unit. They'll come in specifically to cover breaks. We've also seen other units where they staff above. And because as we've said multiple times, staffing above your minimum number does not get you cited. You are not that gives me a double negative there. It is acceptable under the nurse staffing rules to staff above your minimum number. The issue is when you go below that.
We have, when we're talking about this though, we have seen some hospitals that say, okay, well, when we want to set our minimum, we want to make sure we don't go below that on our meals and breaks. So what should our minimum be during meals and breaks? And they set that as their minimum then for the entire shift. And the issue then becomes when the hospital says, well, that's the minimum, that's what we're going to staff it as all the time. That's going to be for the whole shift. And that can be incredibly frustrating to the nursing staff members on the unit. So I would say that's something for the nurse staffing committee at the hospital to consider when you're looking at those minimums. The converse of that is if a nurse staffing plan were to say, our minimum is 3 RNs and 2 CNAs, but during breaks, our minimum is 2 RNs and 1 CNA. And our question would be, well, what is different about the breaks? Because your staffing plan has to take into account census and total diagnoses and acuity and intensity and other factors. So what is different about your patient population during meals and breaks? Certainly we see that there are units where night shift you staff with fewer people because you think your patients, and hopefully it then plays out that way, that your patients will have different care needs during that shift, and you will be able to safely staff with fewer individuals. But if it's in the middle of a shift that you somehow believe your staffing plan should be different than for the rest of that shift, then surveyors are probably going to ask, well, what's different about that? What is different about that time that your patients are less needy? And there are some units that actually, there are certain outpatient units that just close for lunchtime. A lot of other units don't have that sort of option.
And something to keep in mind and remember again, as it relates, it's primarily to those outpatient clinics, like Anna mentioned, if they're closing for lunch, those minimum numbers apply if there's 1 patient on the unit. So if you have 0 patients because you've closed for lunch, then minimum numbers, you don't have anything you need to meet because there are no patients.
What about, do meal and rest breaks cover charge nurses as well as staff nurses?
Part of that depends on the role of the charge nurse. If the charge nurse is a direct care nursing staff member, then yes, their meal and rest breaks also need to be insured.
And I think it would also depend on how the charge nurse is reflected in the nurse staffing plan.
So I do see a question here. Must CNAs or technicians covered by a waiver complete their meal break within 6 hours of start time?
So that has 2 parts to it. One is the 6-hour issue, which is a BOLI issue. And then the second issue is actually, I want to draw a distinction between CNAs and techs, because CNAs are nursing staff members, so they're covered by the nurse staffing law. And so the nurse staffing plan has to account for them. Techs are only counted when there's a waiver, and they only count for purposes of minimum numbers of nursing staff members. So techs do not have all of the protections of the nurse staffing law. So techs don't have mandatory overtime requirements that apply to them. Techs don't have meal and rest break things that apply to them. So the CNAs would, the techs wouldn't, and then the 6 hours is a BOLI issue.
And then I will add too, if you do have that waiver to allow technicians, that waiver is purely for allowing technicians to count towards minimum numbers. It's not making technicians nursing staff members. So this can come up in different issues with, for example, the nurse staffing committee needs to have 1 non-RN So a technician, for example, if you have a waiver, that technician is not counting to being able to fill that seat. And the technician would only be counting towards minimum number requirements. So I see a question here. Does each individual break need to be documented whether taken or missed, or does a summary at the end of the shift qualify as appropriate documentation? For example, right, I missed 2 breaks, but received a meal break.
I think that's a really interesting question. What I would say is it's when we're talking about a summary in the way this is phrased, it's a summary of that individual's time, not a summary for the unit as a whole. Is that how you're reading that as well?
Yes, that's how I'm reading it as
okay.
Well. And we do need to know whether each nursing staff member did receive their meal and rest breaks as required. They could be chosen as that sample. I haven't actually, for most individuals, it ends up being a Chronos system that they use. So I'm thinking of this as being more paper documentation. I'm trying to envision what that might look like.
I think it sometimes is also, though, in Chronos that sometimes there's an attestation or something similar when somebody clocks out. Did you get all your meals and breaks? And if not, what did you miss? And I think that is, I think that would work in a survey. I don't think it has to be. Contemporaneous in the moment, at the exact moment you missed your break, you document that you missed your break. I think the question for us is always, is it getting documented? And if it's a sort of thing in Chronos where you don't get to sign out, you don't get to clock off until it's answered, then chances are it's going to get answered. So we have a question, do ratios have to be maintained during breaks?
So this is getting into a couple different things. I'll tackle the ratios issue first. So the nurse staffing rules actually do not address ratios. Ratios are not part of the Oregon nurse staffing law. Instead, what's required are minimum numbers. So those are minimum numbers of RNs, LPNs, and CNAs. And so for any given patient census, it should be very clear that you can just look at it and say, okay, this is a 20-bed unit. We have 18 beds filled. This is the number of RNs we need, the number of LPNs we need, and the number of CNAs we need, and we cannot drop below that number. And now, so that's the first aspect of this. It's always got to be clear just what that number is for any given shift and for any given patient census on your unit. The other side of this is that question about meal and rest breaks. And so, yes, you cannot drop below that minimum number during meal and rest breaks. And the other aspect is when you have that nurse on a meal or rest break, if you've got an RN on a break, an LPN on a break, or a CNA on a break, they're not counting towards your minimum numbers. So you need to make sure that you don't drop below that minimum number when someone goes on a break.
We also have a question about what follow-up documentation are we expected to provide if a staff member misses a break or lunch? And I would say there's more than one way to document this. I think surveyors often end up looking at payroll records, but there are also units where they track it in a paper form, or I've seen some interesting charts that are used. I think there are a variety of ways to track it. The question
Chronos attestations.
Yes. The question is really, are we able to determine if people got their meal and rest breaks or not? And if you aren't tracking it, we can't determine whether or not it's happening. We've heard from nurses, undocumented is undone.
I see a question here of, can the nurse manager count as coverage for floor nurses' meal and rest breaks? And that actually is something we see sometimes, especially for some of those smaller hospitals or some more specialized units. The question becomes, does the nurse manager have the required qualifications, competencies, and trainings to work as a nurse on that unit? And so if all of that's documented and they have all of those trainings that would be required of an RN working on that unit, then they can certainly count towards those minimum numbers. They have to be doing those assignments of those direct care assignments during that period of time to count as the minimum numbers, though.
We have a question about when there's specific meal and rest break language in the contract, just referencing that in the nurse staffing plan.
And again, I would say keep those separate documents to the extent you can. If you do have language that is in the contract and you say, you know what, this really applies here, it does really talk about ensuring people get breaks or ensuring we don't drop below minimum numbers, if it's addressing that aspect of it, then what I would say is copy and paste the language and put it into the nurse staffing plan. Don't cross-reference to the union contract. You do want to keep those as separate as possible because there is a nurse staffing rule requirement that the nurse staffing plan does not create, preempt, or modify a collective bargaining agreement.
We have a question about what about staff members who do not want their 15-minute breaks? And I think that ends up being a problem if they don't take their breaks, because we can't determine whether that was because someone didn't want a break or couldn't take a break. We're looking for compliance with the law, and the compliance is that the staffing plan is such that individuals can take their breaks. And if we can't determine it, saying I didn't want a break, that's a bully issue. That's not my issue, but that is certainly an issue for us to be able to determine, well, are these people getting meals and breaks or not?
I see another question here. What is the record keeping compliance, so the rate of tags, from hospitals demonstrating they are capturing when nursing staff members are taking breaks? Is there a challenge to record keeping?
So I'm noting the person asking the question cites the E604 tag, which is a tag where we often see a lot of different issues. One of them is documentation is throughout this tag, but we also see documentation of qualifications and competencies. We were discussing this as a team yesterday, though, and I believe we would actually cite this under 646, which is the meal and rest break rule. So if the nurse staffing plan doesn't have meal and rest breaks included in that staffing plan, that would get cited as 646, as well as if people are missing their meal and rest breaks, we would cite that, or if the meal and rest breaks are not documented so that we can't tell if people are getting their meal and rest breaks, that would also show up in 646. In terms of the prevalence of this citation, it does sort of vary from year to year, and I would refer you to our website where we have our year in review. We have several years of that, where we go through and show how many of each tag we had during that year. That's also something we present to our nurse staffing advisory board at our February meeting, and those board meetings are open to the public, and you can always find the schedule and the Zoom link for the meetings on our website.
And I will say those year in review slides, and not to be confused with the legislative report, which is also on our website. Got to keep scrolling a little bit past that to get to the year in review.
The year in review is way down at the bottom there.
Yes. And I would say, as it related to that, putting that in 646, that's very analogous to those overtime citations, where if the hospital lacks documentation to show whether that's mandatory or voluntary, that also is a problem. It needs to be very clear whether it was mandatory or voluntary. Similar with meal and rest breaks here, it needs to be very clear whether nursing staff members receive their meal and rest breaks. And so if they don't have that documentation, that would go into that meal and rest break citation.
Right, so that's another situation where it's not, the documentation issue isn't showing up in the 604 tag, it's showing up in the subject matter tag.
Yes.
So we have a question about whether it's RN, LPN, and CNA breaks documented, not just RNs. And that's right, because we're talking about all nursing staff members. So RNs, LPNs, and CNAs who are assigned direct patient care duties. So there are within some hospitals RNs working in other units where they aren't doing direct patient care, then that's not going to be what we're looking at. We're looking at those RNs, LPNs, and CNAs on the patient care units.
I see a process question here about, can a charge nurse check in with staff and sign the break log for the nurse with permission? So I think that also gets to the question about, is it clear, did the nurse get to take a break? And are they signing off and being able to say, yes, I got a break, or no, I didn't get a break?
Right. So we have a question about how do charge nurses play into coverage, and it indicates ratios and minimum numbers. Can a charge nurse do two roles? And my question would be, how is the charge nurse reflected in the nurse staffing plan? Does that charge nurse have a patient load or not? Are they taking on, are they changing the minimum numbers on the unit or not? If you're using a charge nurse and still meeting your minimum numbers, then that would be acceptable. But if the charge nurse if you're using the charge nurse and you fall below your minimum numbers, then that would be non-compliant.
I see a question here. If a CNA is working as a tech, do they still fall under the staffing plan? That falls into the question of, is that technician required by their position to have that CNA certificate? Are they required to be a CNA, or is it a technician who also happens to be a CNA? So if all technicians are required to be CNAs in that position, then they are considered nursing staff members, and that nurse staffing rules do apply to them. If they are a technician and they're not required to be a CNA, they just happen to be one, then they are not considered nursing staff members.
We have a question, in addition to not dropping below minimum numbers, is there also the expectation that staffing to acuity and intensity does not change during meals and breaks? And we would say absolutely, the unit is expected to staff to the acuity and intensity as reflected in the nurse staffing plan during meals and breaks. If you have a significant change in acuity and intensity during meals and breaks, we would have to ask what kind of unit is it and what's happening here. Now, it could be that it is a unit that closes down or lightens the load during lunchtime, so that would be a significant change in census. Obviously there are shifts in acuity and intensity going the other way, where things can change very quickly and you need additional staff. But in general, if you have set your nurse staffing plan with set minimums as required by the law and said, this is how we're staffing to this acuity and intensity, then it's not any different at meals and breaks. So we have a question about what's the difference between the assigned minimum number and the number of staff needed for the intensity and acuity of each shift. And I'm wondering, does this sort of go towards target and core staffing?
That might be what this is getting to. And so what I would say to that is the minimum number, that is what you need. That is what you need to staff to. You can't go below it. Now you might have something in your plan as it relates to acuity and intensity, saying, you know what, let's modify up if we see these situations. OHA is holding you to that minimum staffing number that's in the plan. If you have a core or target or ideal number, so another number in it that says, you know what, this is our minimum staffing number, we will never drop below this, but we're going to shoot for these numbers here. We can't enforce that core or target or ideal. We enforce the minimum number. And again, if you do have that approach, and it's okay to have that approach with minimum and target / core / ideal, you can have both of those in there, but it needs to be very clear and say, this is the minimum number. We're having this set as our minimum number, and this is what a core, target, ideal is. We can only enforce dropping below the minimum, though.
Right, our review is focused on the minimum numbers because that's what's in the law, and target or a core or ideal staffing, or I've seen some other titles for that. That is not something we would be looking at. We have a question about what happens when hospitals are repeatedly out of compliance with that, with the meal and rest break requirements, and are aware of the requirements and choose not to follow them. And what I would say is the Nurse Staffing Advisory Board has been working long and hard on civil monetary penalties and when and how to use those. And so I would say take a look at our website, take a look at the work of that committee. They will be the committee will be presenting their information to the advisory board at the end of October, and we can see where that goes next.
And you can see all of the committee packets for that committee on our hospital nurse staffing website. You would go to Nurse Staffing Advisory Board previous meetings, just open up that accordion and you can see the previous packets that are on there. As well as the fact that all committee meetings are also public meetings, since we do have meeting recordings available through public records requests.
We have a question for whether there are any suggestions for providing rest and meal breaks while working on call, such as in an OR. Are the requirements the same? And what I would say is the meal and rest break requirements apply, and the staffing plan needs to account for that. Now, obviously, that can be really difficult in that setting. And one of the great groups that I've seen to address this kind of issue is the Oregon Nurse Staffing Collaborative, and I know they've been they've had some difficulty working during the pandemic, but I have heard that there are noises of them getting back together and doing some more work, and this is a great way to share solutions and share things that different hospitals have tried. We can't really recommend any specific solutions, but that's a great safe table area for different hospitals to get together, and it's a combination of direct care nurses and hospitals working together to talk about how to resolve these kinds of issues and what options are available.
And to that second part of the question, I do really want to emphasize about are the requirements the same? And yes, those 11 requirements that we talked about in our last webinar for nurse staffing plans, that needs to be addressed in any nurse staffing plan for any type of unit.
So we have a question about documenting mandatory versus voluntary overtime. I would say we probably want to hold that question for next week, which is our mandatory versus voluntary overtime discussion. But I will say generally there are a variety of ways to document it. The issue is it documented? Because if something just shows as overtime, we don't know if that was voluntary or mandatory.
I see a question here of, do minimum numbers need to correlate with acuity and intensity of the patients on the unit, or do they more directly correlate to the number of patients on the unit? And so minimum numbers established according to an average patient population, and then you use acuity and intensity to staff up.
So minimum numbers should integrate with the actual patient census to set that minimum. What is the minimum for today? Which may be different than the minimum for tomorrow, and it may be different than the minimum for this afternoon. So it really is a combination of basic census and how sick are these people and how much interaction do they need with the nursing staff members, that intensity piece, which is different than the how sick. So, and there are units that staff up from that, but the minimum should be incorporating both the census and the acuity and intensity.
I think we've seen some hospitals have success with it by saying census versus like low acuity for the unit based off a score, and then medium based off a score, and high based off a score, and then setting minimum numbers more in a table, I suppose.
Yeah, the matrix system. We've definitely seen that quite a few times. We have a question about whether ED techs that hold the CNA license but work as a tech count as nursing staff. They're not working under their CNA license. If they are not working under their CNA license, the question is really, are they required to be a CNA in that position or not? If they're not required to be a CNA and they could be a tech without being a CNA, then they are not nursing staff members, and therefore they wouldn't be covered by the nurse staffing law. And to count towards minimums, there would have to be a waiver to count those individuals. Some of them might have a CNA license, or certification, some of them might not, but they are not working as CNAs.
See a question, if any meals and rest breaks are missed during a shift, does that count towards the percentage of shifts for which staffing differed from what is required by the staffing plan? And that's related to those annual review factors. And I would say yes, that would be an example of a shift where you're not meeting your nurse staffing plan.
That is interesting though, because that's asking about missed meals and breaks. So if they never dropped below minimum because everybody missed all their meals and breaks, then it may not fall into that, but it could fall into, there's a category on that annual review for any other factors that the nurse staffing committee wants to consider. So that would also be another way where that could get reviewed and looked at, especially if that's a significant problem. We have another question about mandatory overtime when an OR case runs over, and I'm going to go ahead and defer that to next week when we're going to really focus on mandatory overtime.
Yes, next week's all about that overtime, and we will go into great detail. I do see a question about minimums, which is, I will address that now, but it's asking if it's based off of different devices. And I think that's related to probably those procedural areas. What I would say is minimum numbers are based off of patients. And so how many patients are on the unit? How many people do you need to care, given that there's X number of patients on the unit?
But when we're looking at specialty devices, we also get into skill mix. And I would also say that we get into acuity, because there may be certain patients where you have to use a specialty device, and that reflects either increased acuity or a different intensity. And so that should be part of determining the minimum on that shift.
Okay, question, if Kronos has attestation for meal and rest breaks for all nursing staff members, is more specific documentation needed as to time breaks were taken? So issues related to timing of breaks, that's all about all BOLI's area. Our question is, were nursing staff members receiving their meal and rest breaks?
And I would say, you know, if there's more specific documentation available, we would certainly look at that. But if it's Kronos attestation, I would think surveyors would use that as well.
A question, how far back in terms of days or months of record keeping specific to meal and rest breaks do surveyors typically request?
And I think that really depends. Often on survey, we're looking in the past several months, and those are the dates we're picking. But we can and do look further back if we're looking at specific complaints. Then we'll look at the specific incidents that were alleged in the complaint. So that can, depending on when we get the complaint or when we're able to investigate it, that can be further back. Although I would say employers generally keep that data for longer for other reasons.
Yeah. So I see a question, if an outpatient unit has a schedule so that patients don't come during lunch, what would be required in the nurse staffing plan in regards to meal and lunch wording? So we can't give guidance on that specific wording. What I would say is that meal and rest break requirements, minimum number requirements apply when one patient is on the unit. If you have 0 patients on the unit, that minimum numbers don't apply. And your nurse staffing plan, though, still needs to address meal and rest breaks, how people are getting them, and how the unit doesn't drop below your minimum numbers. So if your process is we're closing the unit, there's not going to be any patients on the unit between this time and this time, then that could be your process to ensure that you're not dropping below minimum numbers and that all nurses are receiving meal and rest breaks.
I think, though, you may want to at that point think about, well, if we have one patient
Leftover.
one leftover who doesn't leave the unit during that time, how do we ensure the minimum numbers, and how do we then ensure that those nursing staff members get their meals and rest breaks? This does happen on outpatient units, and it is workable, but you're going to want to include that in your nurse staffing plan.
So I do have a question about, with an example here, about if a staffing plan has a minimum requirement of, let's say 4 RNs and 1 CNA, and they staff with 2 CNAs and 3 RNs, are you meeting minimum numbers? And no, you need to have, you can staff above that, so an RN could take the CNA's position. So for example, you could have 5 RNs and 0 CNAs and be all right, but you can't staff below that in terms of licensure requirements.
Right, so if you say you need 4 RNs, then you need 4 RNs, and you can't double up CNAs or count other people. If you say 4 RNs, they need to be RNs, and they need to have the qualifications and competencies to work in that unit.
The alternative to that is if you do have 4 RNs plus 1 CNA, you could instead do the 5 RNs.
We do have a question. Someone indicates that there's an issue with the microphone. I'm not sure that we haven't heard that from other folks, but I will say that this, like all of our webinars, will be posted on our website, so anyone can listen to it at any time. And we expect that by about the middle of next week.
And so there is a question about logistics with charge nurses covering other people's meal and rest breaks. What I will say is if your nurse staffing plan has charge nurse as a role and they're it's part of that minimum number, then you may be dropping below your minimum number if the charge nurse is covering that meal and rest break, because now you don't have a charge nurse.
So we have a question, if people are attesting they got their breaks, but this is using the buddy system and dropping below the minimums, how would this be addressed? So first of all, that is something to raise with your hospital nurse staffing committee, and to say this is not, we're not keeping to our minimums, we're not actually complying with the law. And then if we were to see that on survey and say, well, yes, everyone's getting their break, but you haven't demonstrated how you're staffing and meeting your minimums, that would actually get cited under the minimums rules. And it could be cited, would it be cited under 646 as well?
Yes, we would be putting it under 646 in that they don't have a process to ensure
that they meet their minimums
during those meal and rest breaks.
And then we would also cite for not meeting the minimums.
Mm-hmm.
We have a question about behavioral health techs who are covered under a waiver and there are no CNAs. Are they considered nursing staff members? And again, techs who are covered by a waiver only count for purposes of minimum numbers. They are not nursing staff members for any other purpose. So they don't, the meal and rest breaks would not be reviewed for them.
So Anna, I will point out that time flies fast. We're already at 11 o'clock.
And we do want to be respectful of your time. So with that, we will wrap up for the day. I will move us along just quickly through our last couple of slides, letting you know that we still have 4 webinars left. Our next one will be voluntary versus mandatory overtime, including record-keeping requirements. And then we'll come back to nurse staffing during an emergency, where we're going to talk about that new emergency rule. We're going to talk about the nurse staffing complaint process, and then we will finish up with a webinar on the staffing committee requirements and some resources that are specific to our topic today on our website. We have the nurse staffing interpretive guidance, and it has the meal and we got, sorry,
It got included in parentheses, the
other thing that in our sample nurse staffing survey toolkit, we have our meal and rest break practice tool. And it's also worthwhile to take a look at that unit review tool, because that also has questions about meal and rest break. And you can see the kinds of questions we actually ask on survey. You can see this is, we put that sample nurse staffing survey toolkit up online. That's the test. And we put out the test in advance so everyone can see what we're measuring and how we're measuring. And we even have on that unit on-site review tool, we have the explanation guide that goes through the tool in detail and explains each question.
This is what we're asking. This is what information we're wanting to gather when we ask this. This is what this means.
And then finally, we have the nurse staffing reports and the approved plans of correction for all of our nurse staffing surveys from 2016 to the present. And so you can see what those citations look like and different options different hospitals have used to try to resolve those issues. So with that, thank you for taking the time to participate today. We have very much feel like we've gotten some great questions. And if you have additional questions, you can always email them to our email box, mailbox.nursestaffing@odhsoha.oregon.gov, and go ahead and take a look at our website where you can find all the resources we've referenced.
Thank you, everyone.